Hey there, Dr. Jason Kim here. Thanks for joining our YouTube channel. Continue to like us and subscribe to us. And lately we've been on this technology trend. And so another tool that we use for making our procedures more predictable and making our procedures more easier for both the patient and for me is using what we call surgical guides. Now, when I do implant surgeries, many times I've done implant surgery just freehand, meaning just opening the gums and really just seeing the bone and seeing where I think is going to be the best place to place my implants. So that's what we call free-handed surgery. Today with technology, we can use technology to help us be more precise by using what we call a surgical guide. And what a surgical guide is exactly what it sounds like. It means it's guiding us during the surgery. So what that means is I can use this surgical guide. It's basically an acrylic template with holes of exactly where I want my implants to be, right? So this surgical guide is what we call a tooth-borne surgical guide, meaning it's going to sit right on top of the teeth, right? Because this is only for a couple of implants. So this surgical guide is going to be placed on top of the teeth, and it's very, very stable. And these holes are where exactly the implants are going to be positioned and placed. So that's why using a surgical guide is going to be more quicker, much more precise, because we planned the case ahead of time. Remember, in a previous episode, we said we want to know where the final goal, what the final destination is in terms of our crowns and teeth. And even with implants, we need to know precisely where the implants should be positioned and placed. And so a surgical guide will allow us to place those implants very precisely because we planned it ahead of time. Now, how do I know where they need to be? Well, it's planned because I know where my final crowns are going to be. And depending on where the final crowns are going to be, that's going to dictate where the implants need to go to give you the best functioning teeth, the best looking teeth, so that you can be healthy, functional, and aesthetic all at the same time. And so we can do this surgeries very simply, very quickly, very precisely, and even have teeth ready at the time of surgery. So we could place the implants, and I could have temporary teeth made ready to place on the day of surgery, so that way you can go home with teeth on the day of surgery, so that you're not walking around with a space. So guided surgery, surgical guide allows us to really be, what does it say? Stress-free implant dentistry, because this surgical guide allows us to place our implants with precision, and it actually makes it much faster, and it makes it much more less invasive. So a much more comfortable experience for the patient. So whenever possible, we'll use a surgical guide. I've been doing implant surgery for over 20 years, so I can do them freehand, but surgical guide is going to make it more precise, more predictable, and actually less invasive for the patient. So overall, guided surgery, if we can, we want to implement guided surgery for all of our cases. So hopefully that helps. If your doctor's doing implant surgery, you want to ask them about guided surgery. So hopefully that will allow you to make a better, wiser decision so that you can have a healthier, natural, and aesthetic looking smile. Thanks for joining us. Like us. We'll see you next time.